Madam Chairperson, Professor Sarah Chiguli, Professor John Dumba Sentamu, Professor Nelson Sawankambo, Principal Makerere, members of the association, health professional educators, service providers if they are here, ladies and gentlemen. First of all, let me thank the organizers for inviting WHO to make an opening remark at this important, auspicious gathering. I take this opportunity also to bring the greetings of Dr. Louis Sambo, our Regional Director of the WHO African region, who I know is very committed in supporting organizations of national, regional, and sub-regional professional associations to discuss and expand knowledge that ultimately contribute to bringing solution to outstanding issues affecting their professional career and work. In this case, a very particular group, health professionals, educators. I also would like to thank EAHPEA for picking the theme of the conference, Strengthening Systems for Health Professionals Education, which I believe is timely as we are in the middle of a crossroad. Judging from the different topics depicted in the program, a lot of thinking must have gone into it. Like in many other fields, science and technology is moving fast in the medical and health fields as well. And the organizers, to me, are calling all stakeholders to positively respond, transforming the education system, to respond to emerging needs and prepare the graduates for the 21st century healthcare needs. Knowledge and technology is moving fast for us to harness and improve the way we train our graduates, to ensure that they are not left behind. I'm sure that the experts will bring out critical issues to trigger a dynamic exchange of views and information, to filter and come up with a joint recommendations or communique to be applied by the respective educators and also education institutions accordingly. As World Health Organization, the human resource for health is central and is one of the 6 pillars in the health system strengthening model. The achievement of the whole of the system is anchored on skilled, equitably distributed, motivated and sustainable human resources for health. The starting point, of course, is having dedicated and motivated human resources that can make a difference in the health professional training institutions. So that's the starting point, improving and reaching the graduates from where you are managing them. Delivering a good health service is acceptable, affordable, accessible and of good quality, is challenged by a number of systemic problems, including low numbers of health professionals, poor distribution and retention of the existing health workforce, mismatch of competencies to health workers, to patients and population needs, poor teamwork, lack of continuous care, predominant hospital orientation at expenses of primary care, among others. These are some of the issues raised when we interact with the service providers and when we visit them. As far as WHO is concerned, you all witness that WHO is one of the key partners, not only promoting the healthcare delivery, good quality to the health of the people, but also in ensuring that proper training is done at the schools level. Going back a few years, sometimes when I meet people that have been sponsored by WHO to improve their professional career, it tells me that we have contributed as WHO in building capacity of institutions, starting medical schools, postgraduate training on specific areas to make sure that the needs of the people in the countries are met. Such measures in the African region, I can cite at least a couple of decisions made by the member states. One is in 1998, during the regional committee meeting. These regional committees are ministers of health of member states, in our case 46, who meet regularly every year and discuss issues picked up by them, prepared by the Secretariat, and then presented back to them to review, make decisions, and also resolve in a way that they will implement it when they go back to their country. In 1998, the 48th Regional Committee of WHO African Region adopted Regional Strategy for the Development Human Resources for Health, the first of its kind for the region for WHO. This was in recognition that without addressing the challenges facing human resources for health, improving health outcomes and achieving the Millennium Development Goals shall not be possible. This was followed by the African Union Declaration of 2004 as the year of development of human resources in Africa. You can see that most of you have participated directly or indirectly in influencing the agenda on human resource development. And I would like to thank all of you that have contributed directly or indirectly. The WHO Regional Office for Africa, the Economic Commission for Africa, and the new Partnership for Africa's Development, and other partners with Africa and beyond are working together to address the challenges facing health systems in Africa today. In one of the speeches, many speeches of the President of the United States, President Obama, he said we cannot solve the 21st century problem using the 20th century tools or methods, approaches. The same is true with this one. In that effort, the report of the Joint Learning Initiative on Human Resources for Health, supported by the Rockefeller Foundation, published in 2004, succeeded in shining the torch in the crisis. In 2004, the Ministers of Health at the 57th World Health Assembly adopted a resolution to refocus the national and global communities on to addressing the health workforce crisis. Subsequently, the World Health Report 2006, working together under the theme of working together for health, focused on human resources for health, providing a detailed technical data and calling for a decade of action to be led by the Global Health Workforce Alliance. The alliance was officially launched on 25th May 2006 during the 59th World Health Assembly in Geneva. Since then, I have worked working with WHO, country offices included. They have contributed a lot. One of our own, Dr. Francis Omaswa, in his capacity as Special Advisor to the Director General on HRH, and Dr. Lincoln Chen, one of the JLI's lead experts, in his capacity as Special Envoy on HRH, led the setting up of the alliance. The first Global Alliance meeting was conducted or held in Kampala. I'm sure some of you have participated. In particular, the Human Resource for Health Action framework developed by the Capacity Project has made a critical contribution to provide the basis for HRH development. Education is one of the action fields of the Health Action Framework, and the key areas of interventions include pre-service education, in-service training, and capacity of training institutions, training of community health workers and non-formal care providers. The training of health cadres of health workers is an integral part of health system strengthening. Training and education of health professionals has not kept pace with health system challenges due to static, outdated, forgive me my words, curricula. I know sometimes it's very difficult to change the curricula at a short period of time. We are talking about decade. That produce ill-equipped graduates. Sometimes we don't cope up with the development. The Independent Commission on Education of Health Professionals for the 21st Century recommends instructional and institutional innovations to nurture a new generation of health professionals who would be best equipped to address present and future challenge. To this effect, has been already cited, WHO working with partners and stakeholders prepared guidelines entitled Transforming and Scaling Up Health Professionals Education and Training WHO Guidelines 2013. I'm pleased that Dr. Wheeler, our own advisor at the global level, is giving a presentation on that, which I'm sure will bring a wealth of knowledge on this area. The WHO Director General, Dr. Margaret Chan, recognizing that in 57 countries shortage of HRH has reached to a crisis level, called for scaling up training to increase the production of HRH in quantity, but also quality and relevance to address the health needs of the population. I'm sure she will, Dr. Wheeler will elaborate on those critical areas. Transformation of education and training of health professionals calls for understanding the complex interactions between education and health systems. Two questions are key. Are the demands in the health system guiding the training of health professionals, which have been raised by the Vice Chancellor and the Provost? Is the provision of educational services generating the supply of educated workforce regardless of whether it meets the demand for professionals to work in the health system? Is production just one of the necessities that health educators should produce, or is it responding to the current need, which has been articulated by the chair and previous speakers? The balance between the two systems is crucial for efficiency, effectiveness and equity of HRH in health system. There should be a balance between patient and population needs, health system demands for health professionals, workers, and the supply of these by the education system. In this respect, I think, as far as Uganda is concerned, a lot has been done in terms of labor market analysis. The recently done completed World Bank project is one such resources that we can use for as far as Uganda is concerned. I'm sure in other countries the same exists. As part of the closer collaboration between the health and education sectors, both should have a kind of interchangeable information system that they can use so that one can feed the other. The information system on human resources makes it possible to track the ratio of graduates of pre-service training programs to projected demand by type of health worker. The Ministry of Health has adopted the Health Information System for Human Resources to assist in collecting, maintaining, analyzing and managing health workforce data, and should be available for use by both the providers and also the educators. In conclusion, the education system, both needs structure and process included, need to be strengthened in order to improve its performance. Educational institutions need to increase their capacity to teach in terms of infrastructure, but also improve the competencies of existing staff. And at one point, WHO has done a lot in terms of beefing up the competencies of the existing staff. The collaboration and cooperation between individual health professional educators, institutions, developmental partners and other stakeholders is crucial, and all must have a common vision and mission of health professionals education, meeting the demands and the needs of the countries and the population. The Eastern Africa Health Professionals Educators Association provides an important platform, and WHO encourages such platforms to address specific needs of sub-region or groupings. let me, on behalf of my Director General and also the Regional Director, affirm to you that WHO will remain a strategic partner in this area. Wishing you fruitful deliberations. Thank you for inviting me.